Okay, to stretch the quadriceps in the three planes of motion, what we're going to do is we're going to step forward with our right foot and we're going to reach back as far as we can with both hands. Now for this exercise, it's okay for the heel on the left foot to slightly come off the floor. And what we're trying to do is as we reach back, our hip on the left side is actually going to come slightly forward naturally, which is just going to load those quadriceps eccentrically. Okay, so you can see as you reach back and the knee comes down to the floor on the left side, that's going to stimulate the quadriceps as a group in the sagittal plane. Okay, and then as we progress, we're going to start to play around with it. We're going to get a little bit of a further step, which is going to further eccentrically load them. And then we can play around with our hand clock, so you don't have to just reach 2 to 12 o'clock. Okay, so you can see as it loosens, we're going to start to play around with a little bit of a twist. So we're bringing in the frontal plane and a little bit of transverse plane in the spine as we lengthen those quadriceps. So as the hands go back, the knee goes further to the floor, the heel comes slightly further off the floor. Now don't worry about the heel because the heel has got nothing to do with it. All we're doing is trying to bend the knee and extend the hip. Okay, that's going to get that nice eccentric load. Then we're going to go down onto our knees. Okay, reach back as far as we can to stretch the distal quadriceps. Same thing again, we're just going to drive back. Okay, obviously if you've had any operations or any knee issues, be very, very careful. So as I reach back, you want to make sure that the hip comes forward. That's going to get that last little bit of the distal fibers of the quadriceps and right up into the vastus lateralis proximal fibers there as we reach across the body. So the left vastus lateralis proximal fibers will be stimulated. Again, make sure there's no pain in the knees whatsoever doing this. This should be a pain-free motion. If you have pain or history of surgery and you don't like that position, make sure you don't go into it. Okay, use your best judgment or get assessed by a physiotherapist prior to using this stretch.